My name is Derek, a first aider. So I'm going to give you the first aid services. Yeah. So feel comfortable. Yeah. So first aid services for a person mwenye ako nini, ako na, I identified that the casualty here, the blood was spurting from the open wound, so that identifies that it was a artery damage anything. So the first step I have to take is to apply pressure to the wound. So, and you can use a cloth or something that can apply pressure. So after applying the pressure, yeah, I also identified that the patient will look pale, yeah. So he had lost a lot of blood. So I had to shift him to, so kasi sitaweza nikiwa peke yangu, I seek for help. Hey, anybody help? Afterwards, I checked if there was any damages, fractures, anything. So gently, yeah. So there was no any damages. So due to excess loss of blood from the knee, so I had to elevate this ensures that there's full circulation of blood. Yeah. So after, yes, after elevating the casualty, so I had to take further action. I asked her, how are you feeling? You feeling good? Yeah, okay, don't, everything shall be okay. So afterwards, I had to change this pair of gloves before going to handle the open wound for the patient after applying the pressure. Yeah. Monitoring. So so here in the monitoring, yes, the monitoring tools, this includes They include BP machine. This is to monitor pressure. The pass pass rate, oxygen level,
What do you use? Monitor the oxygen saturation of the glass.
oxygen. We use oxygen. Oxygen.
Pulse oximeter.
The pulse oximeter. This one, as you can see it. Uh-huh.
So who monitor?
Uh, so and also this as telescope, yes, helps you to vitals. Kuna the blood sugar here. Oh, pulse, oxygen, blood pressure. Yeah, ensure that before you take any vitals, sanitize. You should sanitize your hands. Yes, and also have a record book.
Attention please. Please keep silent and relax. Keep the cuff at heart level.
First of all, the first vital is always the blood pressure of the casualty. Yeah. I'm going to measure your blood pressure to see. Yeah.
Attention please.
And ensure that you record.
Relax.
Yeah.
Keep the cuff at heart level.
Checking the blood pressure. The next step, and you should also ensure that you involve your casualty, so your blood pressure is okay. So the next step, you're going to check your oxygen. Yeah. So this it tells you how your oxygen is flowing in the body. So oxygen.
What else are you supposed to monitor?
And also ensure that you check the capillary fill which is always a maximum of 2 seconds. Here gently at the nail. Yeah, so this, yeah. After that, yeah,
Kamoja inaisha 60 seconds.
sixth,
60 zunguke hivi. So start.
after checking all the vital signs, ensure that you document. So 20, yeah. So primary. So in primary assessment, so the first thing you should check inakuanga danger. So you check the area of the scene kama kuna anything can, so that you can, to ensure the safety of the casualty and the people in the scene, and you na pia as you as the first aider. Two, response. Here you come, gently tap the patient if it, to check the response. Aki-response, yeah, good. As per response, yeah. Then the third step inakuwa you seek for help huko, so you can call someone kusaidie. Then we go, next one inakuanga airway. In airway, you ensure this hapa, and then you can use two methods, up ama jaw thrust, chin lift na jaw thrust. So after doing those, the next step inakuanga breathing. You check the rising and the falling of the chest, and also you can listen here. And the last one inakuanga circulation at the carotid part there, utasikia kaa kuna pulse. Yeah. After doing that, you keep your patient into a recovery position, which inakuwa the left hand side. So in this occasion, the patient and the casualty umempata alianguka. So the first thing you should check inakuanga kaa kuna any bleeding kwa kichwa, gently. Yeah, that's the first thing. So the second thing, unaangalia macho, the pupils. So like hizi ni ngapi? Yeah, so akishindwa hivyo, akikwambia hii ni to check for kaa ame lost the sight or anything like that. Yeah. Ya tatu ni you check the kaa kuna ear bleeding. Yeah. So you check gently. Yeah. So after that, na pia you check for any nose bleeding. Yeah. And after that, you check kaa kuna neck deformity juu ameanguka, so maybe neck yake ili deform or anything. Yeah, gently check. Yeah. After that, alikuwa ame lose consciousness. So to check kaa amegain back consciousness, unaweza muuliza can you squeeze your hands hivi, finya hivi, yeah. So akisqueeze, so hapo utacheck for AVP U, alert response, AVP alert voice, yeah, na pia unresponse, yeah. After that umecheck everything concerns that, and then you check kaa kuna any fractures kwa mwili na any bleeding from other parts. So gently akikaa atatoa tu kasauti hivi, jua hapo kuna something, kuna anything ama yeah, kuna damage kaa ita make sound, so gently over, yeah. After umemaliza hapo, so tunaingia to something known as the injury. So kama amevunjika spinal cord, any damages, so hapo kaa ni kalist kamevunjika, unaweza tumia neck or head. So kwa neck, kwa spinal cord, avoid nini kumuinua inua juu yani, yeah. So that can result to more damages ama spinal cord nini, yeah. Hey, so kaa kuna head injury na kaa he or she is bleeding, avoid applying direct pressure to the
Alignment of the body.
alignment of the body.
How are you supposed to align the body?
But mwili yake
Yeah.
should be at 108
It should be flat.
flat,
To hard. Equal flat beside the body.
yeah.
So, the way.
An angle of that 180 all over, ama flat, and yeah.
Another don't.
Mhm.
You are not supposed to give your client anything, maybe food or drink,
Yeah.
because you don't know whether on the injury behind the head or the neck has led the paralysis of the esophageal muscles. So maybe she can be having, or else she can experience what? Difficulties.
And swallow.
And at that juncture, maybe anaweza kuwa na aspiration, isn't it?
Yes. So demonstration of monitoring and hiding over. Here we check nini, the vital signs. Yeah. First of all, we check the blood pressure. The vital signs 10 to 15 minutes. Okay. 5 to 10 minutes. And also always ensure that you document, because the supervisor. Okay, in this kuna blood pressure, yeah, vital signs and symptoms. Huh? Ka any dizziness, nausea, yeah, consciousness, pain, pain, response. First of all, first step prepare someone is lying down. Yeah, as a first aider, first step ensure that you check for any danger around the casualty, not more than 10 seconds. Yeah, okay. After assessing for any danger, second step it's R for response. Hey, miss, hey, madam, mister. If there is no response, seek for help. Shout, hey, somebody help. Yeah. So after seeking for help, yeah, next step you can tell them to call 911. Yeah, emergency services. Call 911 emergency services. Then next step you check for breathing. So breathing you ah no airway. So airway in these two you can use two methods, the chin drift and jaw thrust. Chin drift you here and then neck. But if you suspect there is any spinal cord damages, if you break any, you can avoid that and use the jaw thrust. Gent. Afterwards, you ensure that you check for breathing. Here you feel and listen for about 10 seconds. Afterwards, as the carotid part happen, you check for pulse. Yeah. In this scenario, you find that your casualty was not breathing and yeah. So you will have to perform CPR and there was no pulse.
What are the indications for doing CPR? What if there was a pulse?
No breathing, no pulse.
The CPR is only done when there is no carotid pulse, because the essence of doing it is to try to create negative pressure in the thoracic cavity, so that the blood can move up to the brain as a vital organ, right? That is the essence of doing the CPR. But if there is pulse, you cannot do any CPR to somebody who is having pulse. Now you can
So
proceed.
in here, I identified that there was no pulse and no breathing. Yeah. So further action and perform CPR. Haya, chenye after checking the breathing, I check for the circulation. So at the carotid part, if there is any pulse, there is no need for performing CPR. But if there is no pulse, you can perform CPR. Yeah. For this occasion, there was no pulse and no breathing. So next I'm going to perform CPR. Yeah, which is always dirty, dirty chest press to rescue breath. Yeah. First of Mask. After performing that just compression, the next thing you ensure that first of all the airway, second at the soft part of the nose, then gently you insert the quicksilver mouth, then you perform 2 rescue breaths, 1 per second. Yeah. The CPR you are performing should be at the range of 100 to 120. That, then another 2 rescue breaths. Yes. And also ensure that you check the rising and the falling of the chest cavity.
I'm James Mugo, KTVC trainer on caregiving level 4 program. Caregiving, it can lead you to nursing, but the scope of practice is of lesser profile because nursing, it entails doing some of the medical procedures like wound dressing. There is cannulation. Cannulation is it is like venipuncture. Venipuncture is steering cannula in a vein. That is a procedure. It is an invasive procedure, right? So that is one area that a caregiver cannot perform. And to narrow short, the scope of practice of the caregivers entails the activity of daily living. And those activities of daily living include giving medications, right? But not the IM injection, not injections, oral medications, but they can also perform instilling of the insulin. They can administer insulin jabs. Another area concerning the practice of the caregiver is bathing, feeding the client, also some other small activities that does not entail the invasive procedures. I can say concerning this course, first of all, it is marketable and it's also a good course because you can also use it in your home setup. You can also use it to take care of your parents, colleagues. It can also commercialize it because you can also keep somewhere an elderly home somewhere, you as a caregiver, and you are the one who will be administering that mandate of taking those people and referring them when the ailment go beyond your scope of management.
I'm Derek, a caregiver student in KTVC. A lot of challenges, but because first of all, before we assess, yeah, kuna you can lack some equipment during the first aid providing vitu hizo challenge, na pia danger vitu hizo yeah.
Nini unajivunia kukuwa ati you are part of the caregiver, like you are saving some lives? Nini unajivunia in all that?
For me, I'm so passionate about that because a day after nikimaliza hapa, I'm going to go pursue nursing yenyewe. Yeah, I'm so passionate in this course, medical field. Yeah, and it's also marketable. Very much. It's very marketable. So what I can advise those who are coming this intake, yeah, first of all, put God first. Yeah. Second, mtihani ilitoka, wewe ulipata kenye ulipata, appreciate, be thankful. Yeah, life continues. Usiwahi give up. Don't lose hope. Continue. Yeah, because that grade si yenye inafaa kushut down. That grade should motivate you to become someone better.
My name is Maureen Wanjiru from the Red Cross Club. I'm the secretary. So today we had joined the class of caregiver as they were doing the exam. And we had tried to assist them where they will not be able. We assist them again knowledge from them, and them they have gained knowledge from us. Red Cross is about volunteering, but if it is you are being paid, it's okay. But mostly Red Cross is about voluntary work, and in that you work with many people, you experience many things, and you assist others, and also you gain knowledge.